Everyone, welcome to Hackverse. We are deep thinkers. Our theme is all about healthcare. Before that, the quality of healthcare in any country is based on the standard healthcare infrastructure. And do we have the standard infrastructure in India? I don't think so. In India, we lack with proper healthcare ecosystems, lacking with transparency and accountability. We don't have proper infrastructure in healthcare. So, despite of huge fundings from the government in 2024 and the previous years, for example, in 2024 they have funded around 90,000 crores for the healthcare, but still we lack with really poor infrastructure, improper crowd management of doctor presence, and sometimes doctor will be absent. There is no proper medications facilitations, and we face corruptions, leakage of funds from third party or government officers. We face a lot of problems, and my question is that where is the money going and why do services still suffer despite of heavy funding? Yeah, we have funding, but where's that money even going? We don't have any transparency. We don't have any accountability. Where is that money even going? So, we, Swasth Bharat Monitor, our Swasth Bharat Monitor solves with fully transparency and accountability and sustainable development in healthcare in India. Throughout India, we gonna implement it. So the full flow fund transparency will make sure that the fund will be transferred from the central to the hospitals perfectly. Means in the workflow, as I mentioned in the workflow, that the fund transfer from the central to state, state to district, and district to hospital. So our monitor will monetize, will make sure that the fund will be transferred legitimately from central to hospital without any leakage of money uh, through the third party players like government offices. So no mediator can swallow a single penny. So everything will be regulated in real time with AI analytics layer. So which detects anomalies in the data processed from it will be able to detect the anomalies from the data sources in the data processing with connected to the hospital dashboards, such that by processing all this data, the AI layer will be in the capable of analyzing the anomalies and sending the notification alerts to the transparent dashboard, which makes it legitimate for the hospitals and legitimate for the healthcare in India. And our healthcare system is being powered by smart queue management system and doctor accountability. So the OPD, the patients like OPD patients can book tokens using the mobile apps through our smart queue management system, such that it will reduce the queue unnecessary queue in the hospitals. And even we the nation faces the doctor accountability problem, and that can be solved through the integrating the GPS for the doctor login and log out, such that it ensures the availability of staff in the healthcare organizations or in the healthcare or government hospitals for the service of the people. And we are completely unique by the fund flow transparency, such that every data is been updated and processed in our ecosystem, which is also powered by smart queue management system like scheduling appointment for OPD patients or simple tasks with real-time GPS tracking, and ensures staffs and doctors will be legitimate in working hours. This makes the flow transparency makes us unique, and this implementation uh, would definitely revolutionize the healthcare in India. And there's a huge impact socially. It leads to sustainable infrastructure development in healthcare in India, which is a really huge impact socially for the ecosystem and for the development of peoples in India. So, by building trustworthy ecosystems with transparency and accountability, with a huge future, there's a huge future ahead for this our Swasth Bharat Monitor, such that it regulates all all the fund transfers, all the fund transfers from the central to hospitals and everything, and ensures that every amount spent will be towards the healthcare, and it should be legitimate. And just like that, as UPI transformed payments in India, Swasth Bharat Swasth Bharat can monitor healthcare in India. We believe it, and thank you.